Hello, my name is Dr. Chobanian, Susan Chobanian, and today I'd like to talk a little bit about facelift surgery. The technical term for facelift is rhytidectomy. Rhytids mean wrinkles and ectomy means to remove. But when we do a facelift, we do a lot more than just removing some wrinkles. We contour the entire face. We like to contour the cheekbones, the mid-face, create a nice jawline, and of course, contour the neck. If you're looking in the mirror and you feel a lot younger than you look, then maybe it's time for you to consider a facelift. My goal in facelift surgery is to address the effects of time and gravity. I like to create a natural, vibrant appearance. I avoid any unnatural or drastic changes in the face. I like to create a more youthful you. We want to maintain your identity, but make you look refreshed and vibrant and radiant. The standard facelift procedure I do as an outpatient. You come in the morning, we do the surgery, you go home the same day. The standard facelift incision starts inside the hairline. I try to avoid any incisions in front of the hairline because women also often like to wear their hair back. For men, it's very important because their hair is generally short. So we like to hide the incision inside the hairline. The incision continues downward in the natural creases and crevices in front of the ear. The incision turns around the earlobe and it goes upward in the posterior crease behind the ear. The process of the facelift is that we lift the skin off the face. We reposition, recontour the fat pads, we tighten the musculature of the face and of course the neck, and then we pull the skin back and upward to create a more youthful appearance and put the structures of the face back to where they were when we were younger. Sometimes the patients don't need an entire facelift, and in some patients we address just those areas that they feel bother them the most. Sometimes it's the lower face, the jowl area and the neck. Sometimes it's the upper face and the cheek area that's been drooping. Sometimes we do a mini facelift. Sometimes we just do a neck facelift, and we alter the incision and the surgery accordingly to what their needs are. Sometimes we have to add additional procedures to the facelift. We often do eyelid surgery or eye lift. Sometimes we do fat grafting to address the deep creases of the smile lines or the fine lines above the lip. As some patients age, their upper lip or their lips flatten out. A little bit plumper lip with fat grafting creates a more youthful appearance. Patients who age with a lot of fat in the lower neck, the lower region, we often do liposuction to help give a better contour to the jawline and the neck. When the patients awake from facelift surgery, we usually have a pretty tight cotton dressing or a wrap. That comes off the day after surgery, and we replace it with a lighter, softer dressing. On the third day after surgery, all the bandages are off, and the patients wear an elasticized chin strap to support the structures of the face. The sutures are removed in approximately 7 or 8 days, and most of my patients go back to work in 10 to 14 days. Patients who work from home or work remotely often go back to work a day or two after surgery. They can do desk work or computer work without any difficulty because you don't feel sick, and a facelift is really not a painful procedure. Facelifts are one of my favorite operations. It's one of my most satisfying operations. If you look in the mirror and you feel a lot younger than what you see, if you have a vibrant, active lifestyle that you want to keep up with, if you're competing in the workplace, you have a profession that is very competitive, then maybe it's time for you to treat yourself to a facelift. I would love to see you for consultation. We'll examine your face. We'll take issue with your individual facial contours and structure, and will plan a surgical procedure according to your needs and desires that satisfies your lifestyle.